and 1,078 cases 2 weeks ago. Sadly, we are reporting an additional 30 deaths since Thursday's update. This includes 4 COVID-19 related deaths today, bringing the 7-day average to 13, which is down slightly from 16 last week. We continue to extend our deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19 and to everyone mourning the death of a loved one. The number of hospitalizations and ICU patients continues to show steady improvement. Today, we have approximately 430 people in hospital, although this is not an exact number, as we know that several hospitals did not report over the weekend. The number of people in ICU reported by the ministry today is 409. We know that some of these individuals are from Manitoba, and they are being cared for in Ontario hospitals. So the number of Ontarians in the ICU is below 400. In terms of testing, 13,588 tests were processed yesterday with a positivity rate of 2.8%. The current 7-day average for percent positivity is 2.3%, and that's down from 3.1% last week. As we see our daily case numbers, rates, and hospitalizations going down, the number of immunizations continues to go up. To date, more than 11.3 million doses of COVID-19 vaccine have been administered in Ontario, and the number of fully vaccinated Ontarians is now over 1.8 million. These are tremendous milestones, and every person vaccinated makes us all a little safer. And starting today, those who got a first shot of an mRNA vaccine on or before May 9th and live in one of the following public health units are eligible to book their second dose appointment. Those health units are Halton, Peel, Porcupine, Toronto, Waterloo, Wellington, Dufferin, Guelph, and York. Also beginning today, individuals who received their first dose of the AstraZeneca vaccine are now eligible to book their second dose appointment at an interval of 8 weeks or more. I do want to encourage all Ontarians to get vaccinated as soon as they can and to receive their second dose as soon as they are eligible to ensure maximum protection against COVID-19. And with that, I will turn it back over to Dr. Williams for some additional remarks. Thank you.
Well, thank you. And you can see that the situation in Ontario is one of optimism. Following up on the modeling briefing last Thursday, our numbers continue to move in the right direction. And this is a credit to a number of factors going on. As Dr. Yaffe noted, the indicators are showing improvement in a number of areas. Our ICU numbers are moving below 400. Our case counts are dropping down. We may see in the next day or so numbers below 400, as we were hoping for. And this is really exciting. Provincial case rates are down, at least as we know yesterday, of 29 cases per 100,000. As you know, for step 1, we were hoping to be down to 25 per 100,000. I think we'll be close to that very shortly. Our R effective number is down to 0.72. That is really amazing, because that means we're reducing day after day in that. Again, the impact of vaccination combined with ongoing public health measures and case contact management going well. So we are optimistic. Our vaccination rates, we are moving well over 74%. We hope to be at 75% first dose very shortly. That is one of the best ones internationally, as well as in Canada. So we are very pleased with that performance. And for you as Ontarians coming out, and we would encourage those who have not come out for a first dose that you should really undertake that, especially with the Delta variant being around, where we're seeing the high impact of the Delta variant on unvaccinated people being worse than that of the so-called Alpha or the UK variant. And so therefore, if you have not been vaccinated because of its high transmission rate, if you have been hesitant, unsure, you should do so and go and get vaccinated, because even with one vaccine, a week, 2 weeks, 3 weeks later, you are protected. So the Delta is still circulating. It's becoming the dominant strain that's out there. While in low numbers, you still can be exposed if you're not careful. So think about it. If family, friends who know someone who has not been, especially someone over a certain age, they should still be convinced to go and get it. Contact your family physician, your nurse practitioner, other primary care provider to get it done. At the same time, our second dose, where we only were about 7 or 8% a week or so ago, we're now at 14.6%. We are optimistic that in a week or so, we may be at 20%. That is well done. And as we've noted today, with our opening up of the high-risk areas and those matters there, some people have had some difficulty booking an appointment in those high-risk areas. While that is a challenge, I think that's a terrific response that people stepping up quickly to try and get their second dose. With the volume of vaccine we're bringing in, with the volume of vaccine going out to pharmacies and to our mass clinics, please sign back in again, because if you didn't get an appointment today, we know you'll get one in the next few days fairly soon, because we're really ramping up the volume of vaccine we're receiving from our suppliers, especially the mRNA vaccine, both the Moderna as well as the Pfizer vaccine. So thank you for coming out. I've experienced last week when I was at one, while the lineups were at first long, they moved through very efficiently, very effectively. And I must say, everyone, through the people waiting in the lineups, were most polite and civil in the way they wait their turns, helping each other. And then the staff and the volunteers were fantastic. So thank you, everybody, for doing a great job of this massive campaign we're undertaking here that's happening in many different settings throughout Ontario. And it's a credit to everybody taking part, and to you, Ontarians, for coming out and getting, if your first dose hasn't been, come and get your first. And your second, please come out and get that. So with that, as you can see, the numbers are coming down. We're making impacts. With step one opening on the weekend, we're seeing that people, as far as I can report, that undertaking these new activities have done so in a very constrained way. There have been some exceptions now and again, but Ontarians, for most of all, have done a great job at this. And we're looking forward, if we continue to get this vaccination and the 2-week period after 3 weeks to get your immunity up, then we can look at pretty sure that we can move into step 3 in the future, and step 2 in the future, and hopefully keep moving on to step 3. So things are on track and doing well. So thank you for what you're doing. And we would now ask, we open up for the media for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
Your first question comes from Randy Rapp from CHCH TV. Randy, please go ahead.
Yeah, hi, doctors. I've got a question regarding today's changes to eligibility for second vaccines. You continuously tell people that they can get their second shot with informed consent. When your guidance keeps changing as to, who's eligible for a vaccine, when they're eligible for it, how do you achieve informed consent? 2 weeks ago, you were telling people that they pretty much had to be a cretin to get a second AstraZeneca shot before they waited 12 weeks.
So, Dr. Yaffe, do you want to answer it? And I may have a comment to make.
Sure. Thank you for the question. I think that what's important for people to realize is that, we're dealing with new vaccines, new virus, new vaccines, and the information is changing consistently. So we want to make sure that we are providing the most up-to-date information and recommendations to the public as soon as we can. And of course, that can cause some confusion. And I would say that if people are unsure and they want more information, they should be either calling their local health unit or their primary care provider for more information. The other thing is we are always making sure that the materials that we have on our website and that are handed out when you go for your shot are up to date and include a lot of all the relevant information for an informed consent. But certainly if people have questions, they should ask and make sure they know what the options are and what they should be doing in their circumstance.
Yeah, and I'd add to that, Randy, is that informed means that you're getting the information. And if we're having new information out and we were not telling the public that and keeping them up to date on that, they would not be informed. Now, that means it's changing. As Dr. Yaffe said, this is very quickly evolving science and information, and they're reading information, they're hearing things from other jurisdictions, so they want to know what is our position if something has been altered. 2 or 3 weeks ago, we did not have any evidence to say, how should we operate mixing an mRNA vaccine with an AstraZeneca vaccine? We wanted to have the best information we had available so we can inform the public. What is the time interval? What's the best time on that? How do we have it? Did we have extra Moderna vaccine to use? Now we do. So we want to make sure the public are kept as up to date as we can. That means you have to stay tuned, pay attention, because some people are saying, I heard this, what's the answer? And so they see the information changing quickly. We have to make sure we give that as clearly as we can, knowing that, yes, it is challenging because it's changing. And as Dr. Yaffe said, if you're still not convinced, you need to talk to your primary care provider, your nurse practitioner, or your public health unit to say, I still want some questions answered, as you would in a doctor's office who gave information for an informed consent. If you have questions, you need to ask those questions, and they are obligated to answer those questions so that you are fully informed when you make that decision.
Follow-up?
Okay, thanks for that. I'm also wondering about the people getting mRNA shots as a second dose when they had AstraZeneca for their first shot. Do you have any stats or anything that can tell us, how many people are opting to get an mRNA shot as their second dose?
Well, the statistics, we are early into the second dosing. We only started doing the mixed mRNA just a week or so ago. A little early to say. We can extract that to find out what that is. We still have a lot of people are insisting on getting their second dose with AstraZeneca anyways in that. And so I would say the uptick, especially if the Moderna, has really picked up, and now we're getting a large supply coming up later this week. I think that'll only accrue even more. So I think it's the options, what's available, which clinics they're going to. They're going to the pharmacy, going to their primary care physician sometimes, or going to pop-up clinics or to the mass vaccination clinics. They have to see what's available when. And with the demand right now, with the second dose, which I'm really pleased with, that people are eager to lining up and wanting to come out, it all depends on the center they're going to at that time. But they do have choice, and that's what we want to make sure they're ready for. But I can't tell you offhand how many are switching in there, but I think there's a large number that are moving over to a second dose of mRNA, but there are still some who are insisting they want the second dose with AstraZeneca as well.
Next question.
Your next question comes from Stella Dupuis from Radio Canada. Stella, please go ahead.
Hello, good afternoon to both of you. So the new COVID cases are dropping, and this is great news, but you repeatedly stated that the Delta variant will take over in Ontario in the next few weeks. So that variant is supposed to be more contagious and more resistant to some vaccines and jeopardize herd immunity. So what percentage of immunity in the population do we need to reach herd immunity with the Delta variant taken into account?
Well, that's a really good question, and we're very concerned about that. We've been watching this and asking other jurisdictions that may be a few weeks ahead of us with their impact of the Delta in their respective jurisdictions to see what have they experienced, what have they seen. We know from our experts, they say that the transmission is higher, the rate of transmission, and the impacts on the health factors as far as hospitalization, ICU admission on unvaccinated individuals is higher than with the UK variant. The experience with one-dose vaccination is less clear on that. We're finding that people with one dose of vaccine, the transmission is still high. The protection, I may ask Dr. Yaffe to comment on that in a moment, of what they've seen with the one dose of the AstraZeneca and the one dose of the Moderna or mRNA vaccine, I should say, is different. And I'll ask Dr. Yaffe to comment on that. What we see with the one dose is certainly the aspects of severity, as in death and or ICU admission, is still reduced considerably. But that doesn't interrupt this transmission. So when you say herd immunity, there's two things that come to mind. What do you need to stop people from getting very ill and getting into ICU? Or what do you need to stop and disrupt transmission totally of the Delta vaccine, of the Delta variant, sorry. And with that one there, I may ask Dr. Yaffe to comment on what might be that aspect. One, between severity versus another one, transmission. So maybe Dr. Yaffe would want to comment on that.
First of all, yes, it's true the Delta variant is growing rapidly in Ontario. The most recent statistics I have for the week of May 16th to the 23rd, the Delta variant was about 14% of the specimens. The Alpha variant, or the one from UK, B117, was still the majority, but rapidly the UK one is going down, the Delta is going up. So we fully expect it will become the predominant strain. It is about 1.5 times more transmissible than the B117 or Alpha strain. In terms of vaccine efficacy from clinical trials with AstraZeneca, and with mRNA vaccines. In clinical trials, one dose was about 33.5% effective in preventing infection. But in real life, it appears that certainly with the mRNA vaccines, that it's more like 47, 48% effective in that way. 2 doses for AstraZeneca, around 60 to 70% effective. And mRNA, we're looking at about 88 to 90%. But this is for any infection. In terms of severe infection, even 1 dose is quite protective. But that's one of the reasons we're pushing up the interval between the first dose of AstraZeneca and the second dose of whichever vaccine the individual chooses, because we want to get people as fully protected as possible, as quickly as possible, with the Delta strain moving up in Ontario as it is. What achieves herd immunity? That is, I don't think there's a really good answer to that. In general, we used to say 75 to 80% vaccine coverage, but again, with Delta, we're not sure. Certainly, the best is to have everybody vaccinated and everybody vaccinated twice, and then at least 2 to 3 weeks after that for full protection.
Follow-up?
My other question is about the hospitalizations. So at the beginning of the pandemic, we saw that it was a lot of older people that were going to the hospitals. And then with the last wave, we saw also younger people. I was wondering, for the people that are left in the hospitals that are hospitalized for COVID-19. So who are these people? Are they older? Are they young? Are they vaccinated or not? Do we have a sense of who they are?
Thank you. Certainly the data we have at the moment, our hospitalizations are going down, fortunately. As we noted, even our ICUs, from where we were a few weeks ago, over nearly 900, we're down to dipping below, for Ontario residents, under 400. So, so the amount of admissions is dropping. The length of stay is going up. It's almost 29.1 days at the moment. That means they are, some individuals are basically fighting for their lives in that on a very long basis, and the staff are doing a lot of care over an extended period of time. And what we find is that so far, most of the data we are receiving, I wouldn't say it's comprehensive totally, is that most individuals going into the hospital, especially ICU, and not doing well are unvaccinated. There are a few that say they have been vaccinated 1 dose. Some got ill within 2 or 3 days of being vaccinated. And I think Dr. Yaffe would agree that means you probably hadn't mounted any immunity yet, so you're basically the same as being unvaccinated. We haven't seen a lot of cases of individuals being hospitalized in ICU who have had 2 doses. And I can't say none at all. I'd like to make sure I was accurate on that. Very, very, very few. And so most of them tend to be, as a lot of our people over the age of, from our long-term care facilities and retirement homes have been double dosed for a while. And now we've been doing the 2 dosing. We have the 80-year-olds and above are now getting out to almost 2.5, 3 weeks. Those numbers are dropping off, but we are still unfortunately getting some individuals over 70 and over 80 who are being admitted that unfortunately have not been vaccinated. And that's indeed very sad, especially their outcome is obviously not going to be that good. And those in my mind are preventable. And it really is disappointing when people have chosen not to and take that risk. And especially if you know a family member, a loved one, that for whatever reasons they've been hesitant or unsure, it is really taking chances and unfortunately very risky ones. And so it still surprises me that we have 70 and 80-year-olds in the hospital and some passing away in the hospital and find out that they were not vaccinated. So please make sure you get vaccinated because in my mind, those are preventable deaths. And it's unfortunate when that does occur. So that's mostly our data at the moment. We're going to have some more in the future looking at the comparison of our hospitalization rates, ICU rates, and deaths in hospital related to the vaccine status, if we can get as best a data or at least a sampling of that to give you an idea of how that is.
Next question.
Your next question comes from Dave Woodard from the Global News. Dave, please go ahead.
Thank you very much. Dr. Williams, earlier today, Ontario Sports and Tourism Minister Lisa MacLeod says that she's been in discussions with you to determine how sports and entertainment venues can reopen safely to fans. In your estimation, Dr. Williams, what are we going to have to see in Ontario before fans would be allowed to attend sporting events or concerts? As well, I'd like to get your thoughts about Canada's Wonderland, who say they're going to reopen to visitors on July 7th.
Well, you've asked a number of points there. First, the minister was mostly speaking about consultation with us about the return to sports activities of the various professional, semi-professional, and high-performance sports groups that we've been in consultation with, how they might put that together right at this time to resume practicing and competition in there. And so we have emulated a lot of the things we learned through the high-quality program of the NHL to see if they can do that through cohorting, testing, and assurance there. Of course, we're going to be looking at, as we go forward with vaccine status. We haven't been approached in particular about the return of fans in that at this stage. We're still reviewing that. So the first phase we're looking at right now is the actual teams returning to competition and sports, knowing that some are phased in over the next number of weeks. And of course, we have the parallel one at the same time of our population trying to get up to 2-dose vaccination, as Dr. Yaffe has alluded to, and how that might impact that as we go through step 1 into step 2. And then what you're alluding to there is when they talk about July the 7th and that, if we're in step 2, we actually have some aspects noted in there as far as gatherings and groups and that. So that's where some are talking about. So you have the framework movement, you have the guidelines around how professional teams and groups and performing arts can do to protect their group teams performing section so that they can undertake to get ready and to do their competitions. And then the one you're asking later, when do we expand further for fans to be in attendance in some aspects, either in limited numbers or other numbers, and that's more into going to the framework standpoint 2 and going into 3. And then, of course, the ongoing success, I hope, with our population vaccine programs, but we have a ways to go to get there at this time. So we're in constant consultation with the Minister of Tourism and Sports and Culture, and we're having a good working relationship with them, and we hope to keep in parallel with that as we're moving through this, so far, a very positive progression towards that, and as everybody wants, resumption of activities.
Follow-up?
Okay, thank you very much. And we're seeing now in the UK officials dialing back the reopening there due to a small rise in cases due to the Delta variant. My question is, if we're mostly vaccinated here, but then see an uptick in COVID cases, would we see widespread shutdowns? And if vaccinations make us less likely to get very sick, at some point do we just accept that COVID's going to be around for some time and we're going to have to live with it?
Want me to comment? Okay. Excellent. What we're seeing in so far, even with the Delta becoming our predominant variant on a smaller and smaller number of cases, we were expecting some areas that have had a large amount of Delta activity already in their jurisdictions, almost like a month ago, that we would see an increase in hospitalizations, ICU admissions, etc. We have not seen that, fortunately, so we're continuing to see that our vaccine, at least the one dose, as Dr. Yaffe's alluded to, that the one dose does prevent against the severity of it. The point you raise is an interesting one as you go through. If it becomes, if you have enough vaccine coverage, that you have very limited transmission and there is not a lot of severity or no severity at all. In other outbreaks in the past, one sees a term called an attenuation of the strain, so it becomes transmittable but more and more mild, more like a normal coronavirus. And for those who forgot about it over time, our common cold infection is a coronavirus. And does it go to that level? And that may be part of the reality in the future. That would be a nice reality to deal with, that people get sick for, if you feel off for 48 hours, and then are we that worried? We're not there yet. The Delta has, as alluded to, especially unvaccinated among ourselves, a large proportion do get quite sick, and some admitted to ICU, and some, and unfortunately die. So it's not there yet, but it's a good point to ask. We continue to look for that. We continue to assess the data here and abroad to see if we can be informed on that with this variant, and there may be other variants in the future to watch for. So a good point, and as soon as we get all that information, we'd be changing our strategy and directions accordingly, but not right now. We're still in the throes of this, variants rising, and our vaccine program is working well. We're moving fast on it. We need to keep moving aggressively, and that's our plan right now.
Last question.
Your last question comes from Rob Ferguson from the Toronto Star. Rob, please go ahead.
Hi, Doctor. Just to pick up on the sports situation, and you said that you're still figuring out what to do with fans. So, would it be possible for, say, it's almost CFL season, or it should be CFL season very soon if it's not for COVID? Could a team or a league say, if you want to buy a ticket to a game, you have to provide proof of full vaccination? Would that work for you as a public health official to get people into sports?
Well, you're raising the the question of the so-called vaccine document, vaccine passport, various names, that you would have something official that says that you've had 2 doses and you're 2 to 3 weeks out, so you have immunity, not only just having received the vaccine. We're asking our public measure table to look at that, especially with public gatherings, how one might do that. The framework allows for some graduated increase in activities anyways. Then we're going to ask them to blend in to say, with a substantial portion of the public, right now we're just at 14% with 2 doses, and they just received 2 doses. We aren't even where we have 20-25% that have had 2 doses for 3 to 4 weeks. We're not there yet. So we're actually having those discussions now. How might we incorporate that into a framework when we get a large proportion of our public who, for example, might go to a sports event. And as you can see, as we're opening up for second dose to a larger and larger cadre of anyone 18 plus, and then we're trying to get our 12 to 17s done, we're up to around 48% of that already. So we're making really good headway with 1 dose, that is, and then have a second dose to follow. So Rob, very good point as we move forward in that, as we get into where we could actually feasibly ask that question and do that. I know you're saying, yeah, we can do that, but only people over the age of 80 can go to the CFL game. That would not be what the public are looking for. So we're looking for when we have enough of a cohort that we could consider looking at that. So it's getting there, but we're still a way off. But as we said, the vaccine turnout is fantastic. So maybe an issue that was coming up sooner, and the sooner we can get to that one, that would be an exciting option to consider.
Follow up, and this is the last question.
Thanks for that, Doctor. Just to dig a little bit deeper into it, theoretically speaking, if we did have, a large portion of people fully vaccinated, then if you only allowed fully vaccinated people into, say, BMO Field to see an Argos game, for example, would it be safe to have people fully vaccinated packed in there like in the pre-COVID days? Or would you still want to maintain some kind of spacing or distancing and those kinds of measures?
Well, this is the kind of details we're trying to look at because you'll have some individuals that'll, there's going to be a mix. If we are convinced that 2 dosing, we see not only no severity, and in fact, no transmission rate down, that would be evidence that we could have people, especially families and members and couples, sitting closer together with each other and not having to wear a mask at the ceremony and that. So right now, we may say you still have to mask because you're yelling and cheering. There may be some low-level transmission. The challenge is how do we ensure that there aren't people mixed in there who have not received vaccine. Hopefully they have been forthright in declaring. And then they may say, well, why can't we go to the game as well? And then how do we incorporate an area where people say, well, if I wear a mask and a distance, I still should be able to see and participate and to watch the game. So we want to make sure we address all those issues there. So it may seem straightforward, but there are some complications in there, and that every citizen wants those addressed before you made some decisions on that matter. So a good point, Rob, and these are certainly ones that are in front of us. We've been looking at them, and we're going to try and make a decision at the right time in the right way that would be safe, consistent, considerate, and ethically correct in all aspects as best as we can.
Thanks, everyone.